Hey everyone, welcome to Professor Long's Lectures in Anatomy and Physiology. I'm Professor Bob Long. You're not going to see me in this video because I'm zoomed in so big that you would be staring at the hairs in my nose or something. Anyway, I got a face made for radio, so you don't want to see me if you don't have to, I guess. I'm going to be going over these models of the beginning of the digestive tract. I have two models here. One of them, we're pretty zoomed in, so hopefully you can see this very well. This one shows us the beginning of the oral cavity. We have the labia, which would be your lips, called the labia. We have the teeth. We have the tongue here. At the base of the tongue, we have this little loop right here. This connection at the floor of the mouth is called the lingual frenulum. I'm not going to ask for the cheeks. I think everybody knows what their cheeks are. But you should know what the lingual frenulum is. Now, I'm going to switch over to this model because what I want to get across to you on this model are these organs, okay? On the outside, we have what are called salivary glands. I'm going to move this model out of the way. We have what are called salivary glands that secrete a solution called saliva. Saliva has a bunch of components. We'll go over that in lecture. But saliva helps us break down and digest the food that we eat. There are three pairs of salivary glands. The first pair is actually on the outside of your mouth, deep to the skin. And I can see this one on this side. There would be one also on the right side of the face. But this gland right here is called the parotid gland. Or some people say parotid, but it's parotid. P-A-R-O-T-I-D. The parotid gland secretes saliva through this tube, which would penetrate through the musculature and dump saliva into the back of the mouth. This tube is called the parotid duct. So the parotid gland, parotid duct. Now, in order to see the other two glands, I have to flip the model around so we're looking at the inside of the face. So you can see the tongue here, and there are two salivary glands, two on the right, two on the left. So there's really a total of four, but we're only going to see one side here. There's two glands here. One is near the base of the tongue, deep at the back of the mouth, and one is very close to the tip of the tongue, right underneath the tip of your tongue, in the floor of your mouth. The one at the back of the tongue back here is called the submandibular gland, and it sits kind of deep to the ramus of the mandible. And the duct coming out of that is called the submandibular duct. The one that is underneath the tip of your tongue is called the sublingual duct. Lingua means tongue, so the sublingual duct is there. Sublingual gland, I should say. This model does not show us the sublingual duct. It only shows us all three glands and only two of the ducts. So again, on the outside, I have the parotid gland and the parotid duct. On the inside here, I have the submandibular gland and submandibular duct. And then this little ball of tissue right here is the sublingual gland. Now, I do have another model that some instructors really like to use that shows us these structures. And so I'm going to do my best to hold this model up and show it to you in the field of view here. Okay? This model is a little bit larger, and you can see how a lot of things fit together. You see the larynx and the cricoid cartilage and the trachea, and the esophagus would run posterior to this. You can see a piece of the mandible and the teeth here, and if I remove this piece, then I can see the tongue. I can even see some of the papilla that we covered earlier in the semester on the tongue. But anyway, if I turn to this side, I can actually see the sublingual gland and the submandibular gland. I don't like this model, so I don't tend to use it on the exams, but some people will look at those pictures and ask me about it. So if I'm going to ask you for the submandibular gland and sublingual gland, I will use this model. You won't see the sublingual duct. Now, one last thing I want to tell you about this before I go on to the next video. If you raise your tongue to the roof of your mouth, if you open your mouth, raise your tongue up, there's a line down there, that's the lingual frenulum. Now, if you run the tip of your tongue on either side of that on the floor of your mouth, you'll feel a little bump sticking up. And that little bump is where the sublingual gland and or the submandibular gland can secrete some of their saliva into your mouth. Anyway, I hope you had as much fun as I did. I hope you were able to see those glands. and I'll see you in the next video. We'll be covering the teeth.